Welcome to the In My Opinion Show with Ronald Barry Robinson and friends. With us, we have a spectacular crew. My co-hosts are Mr. Herman Marable Jr. Welcome to the In My Opinion Show.
Thanks for having me, Ron.
And Mr. Henry Hatter. Henry, as usual, welcome.
Thank you, Ron.
Let's talk about health care. Health care must be approved now while our elected representatives in Washington haggle, undermine, are bought off by lobbyists, insurance companies, Republicans against Democrats, liberals against both, conservatives with nothing substantive that's right or honorable, and the party of no. Hundreds of thousands of uninsured perish. The vast majority are people of color. Healthcare now, since I'm an American of African descent, over 1 million Americans of African descent, men, women, and children have died in the last 10 years because they lacked access to health care insurance. Over 10 million children in America still don't have health insurance now. It is estimated that over 50,000 die every year because they have no health insurance. This is outrageous. Quality health care is a human rights issue. The human toll is coupled by the financial costs. When insurance companies rule, they have no competition and no impetus to lower costs or create access. Their job is to make money, and we are their profit center. If we get sick, the profits they make on us go down, so they create all kinds of clauses to deny sick people coverage, keep premiums high, and maximize their profits. The average salary for the CEOs of the top health insurance companies is over $18 million a year, with millions more in bonuses. We have a chance to change this outrageousness and greed in our history. President Obama cannot do it alone. Without us actively involved, the lobbyists' money will win and health care reform will fail. We are fighting for a strong public option to the current bills moving through Congress. It is the only measure in the bill that will assure real competition and keep health care affordable and accessible. We all stand to benefit from changes being considered by Congress. Those of you who have health insurance stand to gain in the way of lower costs, better coverage, and more choices. If you can contact your congressional representative by calling 1-866-783-2462. Mr. Marable, what is your thoughts on health care?
Well, I think I agree with a lot of what you said in your opening statement. And I guess the thing that I've always thought was odd about, this whole debate over healthcare is that, I don't understand those people who oppose the healthcare bills. There's one that's passed the House, and there's one that, of course, is going to be debated in the Senate, hopefully, here in the next couple of weeks. I don't understand what their alternative is. And I don't understand how anybody can basically advocate for people being sick, so to speak. I mean, there's money to be made, I suppose, if you are an insurance company or if you're a healthcare provider. I would think that some people would like, that aspect. I would think that people would like the fact that we're going to cover more people than we've ever covered in this country. I would think that the fact that we are, the only industrialized Western nation that doesn't have a publicly financed healthcare system, that is something that would allow us to be able to compete economically with other countries that do have health care for their workers. I mean, that's part of the reason why the auto companies and what have you are in such bad shape, because they can't afford to provide health care for their workers. I just can't see the argument against this. I guess I don't fully understand the argument against this.
Well, maybe these people that we call our elected representatives, maybe they've forgotten their moral responsibility, to their constituents, if not their overall populace of the nation. And a second part to that is the lies that are coming out in terms of health care. I'll take, for instance, one of the lies that has been out there, about Canadian health care. Mm-hmm. I lived in Canada for a number of years, all right? I never had a problem, okay, of being provided quality health care. But they're saying, you know what I mean? Oh, you don't want that, you know, and that's a government-sponsored insurance, okay? Me, I think that's the best thing. Mr. Hatter, I know this is something that's very dear to your heart.
Yeah,
So what do you think?
I really do like the introduction to this subject, Ron, and I like what Judge Marable had to say, but I take some issues with government-funded options to insurance. You refer to people who work for, like General Motors, they have insurance. Those are the elitist. They have insurance that's paid for by themselves and by a corporation. And that comprises less than 20% of the population. That's for all businesses that provide the kind of health insurance that we endured for many, many years. But everybody in America has health insurance. It is called Medicaid, Medicare. And Ron,
isn't that government sponsored?
Yes.
So what the hell's the problem with with this other?
Okay, we got to come to that.
Well, how do you figure that everybody has Medicaid? You have to. That's a means-tested program. You have to have below a certain income to qualify for Medicaid, and Medicare is based upon reaching, I think, what, 62?
Yes.
Okay, so how can you say everybody has it? I mean, we know there's
if you live in America,
there's 40 million people that aren't
even if you're foreign
covered.
born, you have health care. Even if you're foreign born, because if you go out and break a leg out here, somebody's going to take care of you.
Well, but
somebody's going to pay for it, and it's going to be Medicaid or Medicare.
If you don't have enough money to pay.
Yeah. Okay, our population gets taken care of. The problem is access, and the problem is due to individuals' own situations where they don't keep up their appointments with their providers and stuff like that, and their conditions worsen. But the reason I would oppose the government option for this reason. I think the government-funded option in health care would be just like the welfare. They treat you like dirt, or some of the other government-funded systems. And many people, there are many complaints that come out of those organizations. How indifferent that they are. Stop it now. You're dealing with health care now.
I'm taking great issue with you saying that everybody has coverage, because that's not true.
Okay.
I mean,
name one that doesn't. Name one American that does not have health care. Illustrate.
Well, listen, I can think of people. I mean, we're not going to name specific people, but
no,
there are people who work in jobs. Wait a minute, the people who work in jobs, say in the service industry.
Okay.
We can right here in Flint, Michigan. You could go to a restaurant, bar, talk to a waiter, waitress, whatever, somebody who works there.
Okay.
That doesn't get any kind of health care coverage from their employer.
No, they don't.
Who may make too much money to be on Medicaid so that they can see a doctor on a regular basis when they get sick or whatever. And they wind up, going to the emergency room for a cold or a relatively minor.
You're right.
And it becomes extremely expensive for everybody to pay for. There's 40 million people or more.
Now, that's the exception. You're right. There's an exception there.
There's millions of people who fall into this category.
No, but when you say that 10 million kids don't have health care insurance, they have My Child, they have Medicaid. All kids are guaranteed medical coverage between their birth and 21 when you're in school. All kids, irrespective of their circumstance. Every child has. And Judge, you know this too. Because you deal with enough schools to know that. But there's that little sliver of people out there that kind of fall through the cracks, and they're the people that you alluded to.
Well,
they may have, all the kids may be older.
Okay? It's not just people who work in the service industry. I mean, there was a whole big controversy about Walmart. Okay. That in a lot of states, Walmart does not provide, in a lot of places,
right.
benefits like health care for their employees. And, they are coaching people in certain states on how to apply for Medicaid and what to do, And this is the world's largest store, the world's largest retailer, multi-billion-dollar corporation, and they're not providing health care for their employees. So I don't know where I don't know where you're talking about this little sliver.
There's a sliver of people there that's not covered, and those are people whose kids are gone and they're older, and they are still too young to draw Medicare, and still too old without kids to draw Medicaid.
But aren't we talking about health insurance?
Health insurance, that's Medicaid, Medicare. Okay. But then don't confuse that with insurance that's provided by corporations, because that's a different thing. Those people are taken care of under a different kind of circumstance. We're talking about the great body of people who fit in the 75% of the population. The ones that we're talking about.
And that's health insurance. That's primarily what we're talking about. Those are the people that don't have coverage.
But you ask me, well, why isn't there? Isn't that in health insurance?
Health insurance. Okay, there's two different things. You got health care and you got health insurance.
Yeah, health insurance belongs to corporations.
Well, I think we're talking about health insurance. Medicaid and Medicare are health insurance programs.
Mm-hmm.
But that's no. That insurance is paid for by corporations, by private individuals, and you work for those people. Health insurance is a government-funded insurance. Health care is a government-funded insurance called Medicaid, Medicare.
Well, yes, it's an insurance program.
You can also have
but
your
it's government-funded.
Yes,
not all of it.
Okay, it's like the third-party option.
So what's your point?
My point is, now you were asking me, well, isn't that insurance? Yes, that is insurance. Well, then...
But you can buy health insurance yourself.
But the third-party option is completely different. It's one that the government will require everybody to buy insurance. Mm-hmm. You will pay for it, whether you want it or not.
And I think that's in both of these bills that are pending.
Now these are some circumstances we're seeing to crystallize the differences here.
And is that something that you're opposed to, that everybody would be required to buy?
No, I'm not opposed to that.
Okay.
But I just think that there are abuses. You never want to give government anything over the lives of people, because they will soon decide when to pull the plug on Ron Robinson.
I don't believe that. I do. I don't believe that.
They're doing it every day.
Okay. Well, wait a minute. Health insurance companies decide when to pull the plug on Ron Robinson or Henry Hatter right now. I mean, there are certain...
No, the family does.
No. There are certain... well, let me explain what I mean. There are certain procedures that might be considered to be experimental, that maybe your health insurance company won't pay for. And if you can't pay... If you can't pay for it out of your pocket, and your Blue Cross Blue Shield or whatever, Humana, whoever you have, won't pay for it, that is deciding what kind of treatment you're going to get. That's going to decide if you're going to, perhaps if you're living or die.
Isn't that inhumane?
Well, when an insurance company...
Isn't that humane? Inhumane. Now, this is part of the problem that's wrong with government-funded health insurance.
No, I'm saying it happens now, Henry. That's what I'm saying.
But I don't see it happening without resistance from families, from other doctors, from the institutions,
There was a case that came out of, I think it was somewhere on the West Coast. I cannot remember what it was, but I remember this woman had some kind of disease. I wish I could remember all the facts, and if I had known we were going to talk about this, I would have researched it.
Okay.
But there was a woman who had some kind of a disease, and she had health insurance by one of the large companies like Humana or something like that. And she and her family, were arguing back and forth with this company for, quite a while about a procedure that she needed that they wouldn't cover. They ended up, after haggling about it, approving her to have the procedure after the woman died. I think the day she died or the day after she died.
That's an unfortunate circumstance.
But that's not an uncommon situation.
but don't make it more than what it is. We don't want to go there. We want people to live out their lives in dignity and with their own in their own circumstances, without government having to say to you, well, Judge Marable, it's time that you check out because we can't afford you anymore. Well, there's a bill out there to that circumstances where government-funded insurance would be removed from regulations in Congress and farmed out to a special
Where are you getting
agency.
this from? You've been talking to Sarah Palin or something?
No,
Did Sarah Palin call you on the phone and tell you this?
Actually,
where's this coming from?
It's House Bill 4200.
Well, I guess we'd have to see that.
Yeah, you want to see that.
Do you think that the government's pulling the plug on people that are on Medicare right now?
This has nothing to do with partisan politics.
No, I
It's
know
what
that,
everybody's afraid
but I know Sarah Palin was actually going around, making that statement. She said there are death panels that are going to decide who's living and who's dying.
Well, I don't know about that.
And it was widely.
I don't follow Sarah.
Well, no, but she said that, and it was widely discredited when she said this. But leaving partisan politics out of it. Do you think that the government is deciding now for people who are on Medicare when plugs are going to get pulled?
I don't know whether the government is doing it, but I know that doctors, through some arrangement,
don't they work for the government?
And
Usually?
generally, family members make the final decision.
Well, but Medicare is a government-funded program.
I know, yeah.
So it's not happening now. What makes you think it's going to happen if
I just had
basically expand the program?
I just had a nephew that died of cancer here, 42 years old. You might have seen it, but in the paper. But they didn't pull the plug on him. He was a young man. But what they did, they introduced a lot of drugs to him to keep him
well, Henry,
clean.
If there's just a little sliver that we're worried about, as you're saying, why not go ahead and do this?
Well, I think that we're going to get, eventually we're going to have that third-party option. I'm just saying right now, the debates that's going on in Congress need to occur so that people are fully aware of what they're getting into. And I don't think that Americans are ready right now. I really don't. And I think that let me say this about partisan politics. I don't think that Democrats are ready for it, and I don't think that Republicans are ready for a time when government will decide when to pull plug on people. And
so that's why we shouldn't pass these bills.
Well, I think that you need to talk about how to resolve the difference between the two philosophies of thought.
Yeah, but see, we've been talking about this for the last 50 years. All right, when is enough talk? Okay, we're gonna have to wait another 50 years before we get a reasonable health care for the vast majority of folk in this country.
No, I don't think that we're talking about that waiting 50 years. I just think that we need to make sure that people are comfortable with it. Now, anytime that you have a government-funded insurance, guess what? Because I have the cost of supporting such a program is humongous.
Well, shit, we're sending $80 billion to fight an unwinnable war over in Afghanistan right now.
But we're going to bring that money back shortly, okay? But the thing is, I don't think.
I want to hear about that.
I don't think that people who have insurance, like yourself, Ron, like you, Judge Marable, like me, like my family, am I willing to live with less to bring everybody else up? This is what we're talking about. We're talking about mediocratizing healthcare or health insurance.
If it would cost me an extra $100 or $200 a year, all right, to bring to provide health care for other folks, I wouldn't have a problem with that.
I wouldn't have a problem with that either.
Because I think it's important.
Well, the other thing is,
but it's not going to cost you just $100.
That's a human rights issue.
But the thing is, we already pay for it as it is. because when that person goes to the hospital for a cold or some other minor
emergency rooms.
Yes, that's what I mean. The ER for a minor problem that they could much easily and more efficiently be treated somewhere else and cheaper. Those costs are passed on to everybody anyway. So we're already paying for it.
But see where we now,
just at a very high rate.
You and I and Ron need to converge here. Like I said, I was far apart on you on this third-party option. For that reason, I told you why. Are we ready to mediocritize those who have good health insurance? I get my teeth cleaned 4 times a year. No BS or anything like that. I get health care checks, and I take exercise.
But that's you.
Okay.
That's you and
yeah,
me,
but,
and Herman. But what about the
I know.
other
You probably
ones?
have one of those Cadillac plans.
No. but no, stop and
Those
think
Cadillac
about it.
health insurance
Now, what I'm trying to sensitize myself to moving over, and I can do this. I take good care of myself, so I don't need the Cadillac plan, and I don't mind stepping down
So you're getting excited.
I don't mind stepping down.
You're not
a
going
notch.
rogue on us, are you, Henry?
No, I don't mind stepping down a notch so that others benefit. This is not.
Why do you think that you'd have to do that? I mean, they are saying that you're allowed to keep the health care insurance policy that you have.
Now, another thing about this third-party option, we should be able to choose our doctors.
You
We
can.
should- Well, I'm not so sure all of that is guaranteed. They were going to probably send me over to Timbuktu and with Willie Brown.
Well, can we go back to what I said originally?
Okay.
See, I'm listening to all of the scare stories.
Okay.
Okay? And what I don't hear from the people who oppose this is what their alternative is.
You do hear that is
Well, I'm listening.
the third-party
I'm
option.
listening to you, Henry.
Yeah, but the third-party option is that people must be able to choose their physician. That's one, and that's not guaranteed. There's no way. And how much will the government interfere with life choices? When to pull the plug and stuff like that. Those things have
Henry,
not been.
Henry.
Those
It's more scare tactics.
No,
The government interferes with life choices all the time, in all different kinds of ways. I mean, well beyond healthcare. I mean,
well,
when
you
we-
haven't convinced me.
When we decide,
this
when
is
the
rhetoric.
when the government decides for what? Wait a minute. Let's look at this. When the government decides we're going to allow. When the EPA says we're going to allow this factory that produces these,
Sure.
cancerous
Yeah.
emissions
Carcinogen.
in a particular neighborhood, aren't they making a choice about who's going to live or die or who's going to have good health?
There are controls for those. Everything that you hear is not the truth about emissions.
And the same thing applies with your argument.
Everything that you
Henry.
hear is not.
But Henry, I mean,
Businesses
when
have
they
controls
when they
on it.
decide when they decide that we are only going to have allow houses to be built near a Superfund site like Swartz
Yeah,
Creek.
yeah.
All right, you don't think that that's making a choice about who's going to be sick and who isn't?
No.
Oh,
No,
okay.
I don't.
All right.
I think that's. I've seen that happen. I saw that happen at where the old Fisher Body was.
Go visit Love
I-
Canal in New York. They
and-
built new houses
Yeah.
over there.
Okay.
Okay.
Okay, and that was also said about the new park down at the University of Michigan, where I believe they built that housing complex down there. They had some arsenic down there that came from another source that was dumped there. It may have come from Buick, but then it may have been part of the natural soil. So I don't know if you remember that. And that project was stopped, and so they had to clean up. And then the DNR came in, and they cleared the site for building. And but there was a scare tactics there by environmentalists or advocates who wanted to see the program stopped.
Love Canal was a scare tactic.
No, Love Canal.
Berlin and Faro and Swartz Creek is a scare tactic.
No, but Berlin and Farrell I have less of a concern about, but I do have great concerns about Love Canal. And there are other places too that where there are toxins, Judge Marable.
I mean, that's why they have a
That-
super fund. That's why the EPA established
Okay,
super fund.
okay.
These things are happening all over the country. All
Well,
over.
those super funds were intended to deal with issues that involved factories that had exceeded their limits for discharge of toxic material that could seep into the environment and get into the waterways. Okay, but then they came out with
Was that a,
Well,
was that
that's our cue,
magic
I guess.
tone?
That's our cue at this time. But at this, that's our cue.
Okay.
All right, got me kind of a little miscombobulated here. I thought that was Sarah Palin coming in. Okay, but anyway, I want to thank our wonderful panel for their expertise and their knowledge. This is Ronald Barry Robinson and friends saying for the In My Opinion